Where the brands differ is in their molecular structure. They're all botulinum toxin type A. But Xeomin is incobotulinum type toxin A, so it doesn't have the binding proteins that stabilize the molecule, says Poelman. Because of this, Xeomin is often hyped as being a more natural, or clean, alternative to Botox, but that's a misnomer, she says. The binding proteins are thought to make the molecule less reactive, says Poelman, so if someone were to react or become immune to Botox or Dysport, they may be able to get desired results from Xeomin. When you visit to the gynecologist, you may feel nervous and anxious as you sit in the waiting room. You wonder for clarity on your vaginal health. Take a look at the 9 questions you should ask your gynecologist on your visit. Bleeding after sex can be normal but should not be ignored, advises Dr. Poelman says. If you notice this once, there's no need to panic and call the emergency line of your OB/GYN, but if you do notice this is happening consistently, you should go in for an exam. Bleeding can simply be from a sensitive cervix, one with exposed blood vessels, but it can also be from a cervical or vaginal lesion, something that needs to be tested and rarely can be cancer. Bleeding during intercourse can also come from the endometrial cavity, like menstrual blood. While most causes of bleeding during and after sex are benign, they should not be ignored, Dr. Poelman explains. You should use emergency contraception if you don't want to get pregnant, Dr. Poelman says. You should also go in to see your gynecologist a few weeks after the episode to do sexually transmitted disease, STD, testing. Immediate testing, as in the next day, will often be negative. Unfortunately, there are no remedies to erase the event. I would not recommend douching or any sort of self-cleansing because this could aggravate the tissue and increase the chances of infection. There is a myth that you should not get pregnant right after stopping birth control because miscarriage risk is higher, Dr. Poelman says. This is incorrect. If you stop birth control with plans to conceive, you can try immediately. If you do not get a period and have a negative pregnancy test after about 8 weeks off the pill, you should speak with your doctor. This may be a sign that you are not ovulating. Discharge is normal in women. This is why we wear underwear and why panty liners are needed. Discharge changes in quantity and consistency during the menstrual cycle based on your hormones. Normal discharge is often clear to white, and sometimes a faint yellow, Dr. Poelman says. Since Gwyneth Paltrow has become kind of the spokesperson for Xeomin, it's been receiving more attention, says Poelman, but it's been around for a while. Xeomin was first approved in Canada for cosmetic use in 2012, and it has been rising in popularity. For years, we've heard more about Botox than Xeomin, or even Dysport, due to Botox having been approved in Canada much earlier than Xeomin, in 2001. With many pop culture references to Botox over the years as well, it is not surprising the brand is well known and that many considered synonymous with or as a catch-all term for cosmetic injection treatments, says Lee. Xeomin is probably the quickest in terms of onset, says Poelman. Patients often see results in 3 to 5 days, but in general, all neuromodulators start to kick in around 5 to 7 days. In terms of how long the results last, Lee says both Xeomin and Botox last on average for 3 to 4 months. It's important to keep in mind that there are other factors that can affect the duration of treatment results, such as the amount injected, the individual's rate of metabolism, and the degree of facial expressions, she says. Those who are more expressive may find their neuromodulator treatment not as long-lasting as their friends. Instead of worrying about choosing the right neuromodulator, Poelman and Lee stress the importance of finding an experienced injector. A board-certified dermatologist or board-certified plastic surgeon will have the most expertise, says Poelman. If you have someone who's experienced, and who knows their anatomy, you're going to get the best results. Many dermatologists offer more than one brand of neuromodulator, and it's up to them to decide which is best for the patient. A patient's values, goals, budget, past experiences, and their health history are all taken into consideration as part of an ongoing process to ensure that their treatments are the right fit and works for them, says Lee. This helps doctors deliver the most natural-looking results and help achieve patients' preventative and restorative goals, she says. Neuromodulators, irrespective of the brand, have a similar side effect profile, says Lee. The most common side effects include minor redness or pain at the injection site, bruising, headache, swelling, and drooping eyelids.